Hello, good people. Welcome to Caloric Diary. Today, let's talk about how to prevent or reduce the risk of cardiovascular disease. But first, here is a brief introduction. Cardiovascular disease refers to all diseases of the heart and blood vessels. Cardiovascular disease is the single leading cause of death around the world, while stroke is the fifth leading cause of death. It used to be the second a few years ago, but it has since been pushed to fifth by other diseases like COVID and just to mention but a few. The most common form of cardiovascular disease is coronary heart disease. Most people consider coronary heart disease to be the adult disease since it mostly manifests itself in the advanced age. In addition, the symptoms rarely appears before one is 30 years. However, the disease process begins much earlier. To begin, infants are born with healthy, smooth, and clear arteries. However, in their first 10 years of their life, fatty streaks begin to develop in the arteries. During adolescence stage, the fatty streaks become fibrous plaques. So as a result, for most adults, the question is not whether you have the fibrous plaques, but how advanced the plaques are and what to do to slow down or reverse the atherosclerosis. In this case, atherosclerosis means the accumulation of cholesterol and other blood lipids along the walls of the artery. You may be wondering, what happens when fibrous plaques advance? Well, the fibrous plaques gradually enlarge and calcify, from the word calcium, becoming harder. The plaques harden the arteries and narrow the passage through the arteries where the blood flows. As the atherosclerosis gets worse, the blood flow to the heart muscles is restricted, affecting the heart, the oxygen delivery, causing heart attack. In addition, it can also affect the blood flow to the brain, causing stroke. Let's discuss the major risk factors for coronary heart disease. They include high blood cholesterol, cholesterol accumulates in the arteries forming plaque that becomes fibrous, and calcify, from the word calcium, blocking arteries. Another factor is hypertension. High blood pressure stresses the artery lining and accelerates the atherosclerosis. Type 2 diabetes is associated with obesity, high cholesterol, and high blood pressure. Inflammation, which occurs as a result of tissue damage, such as in the artery walls. The damage is caused by high cholesterol and high blood pressure. Then there is obesity or overweight, which leads to high cholesterol, high blood pressure, and type 2 diabetes, which was discussed earlier. Now you may wonder, how do I prevent or reduce the risk of cardiovascular disease? Here are some of the things that you can do. Adapt a healthy lifestyle by increasing intake of whole grains, whole wheat, fruits, and vegetables. Consider foods that are good source of soluble fiber, such as apples, broccoli, beans, citrus fruits, oat products, cauliflower, just to mention but a few, because soluble fibers help to lower cholesterol. You can also check my video on cholesterol. I will share the link in the comment section. Then another factor is use monosaturated fat in your diet, such as olive, canola oil, avocado. Something else is to engage in regular physical activity or exercise, at least 30 minutes a day, 3 times a week. This will help in weight management. It will maintain your blood pressure and cholesterol and good to a healthy level. Increase dietary intake of omega-3 fatty acid, which is an example of polyunsaturated fat, because they play a major role in preventing and reducing risk of heart disease and high blood pressure. An example of sources of omega-3 include salmon, fish, tuna fish, trout, vegetables like Brussels sprout, just to mention but a few. Limit salt and alcohol intake. Avoid smoking. If you haven't already started smoking, avoid it. But if you've already started smoking, consider stopping. The reason being, the toxin in cigarette smoke damage blood vessels, leading to atherosclerosis. I hope this video is of help to at least one person. And if you know of somebody that this information could be of help, please share, subscribe, and click the bell for notification of more video when I post. Like my videos. The more people like, the more YouTube will recommend it to other people to watch, and hopefully we can make a change in a lot of people by informing them about these diseases that affect our health. Thank you very much for coming back to watch my videos. Bye.